This presentation, I'm going to talk about why you need a physical therapy blog. I'm going to go through a formula for you and also give you some specifics on how you can get the information out on your website quickly. So why should you have a physical therapy blog? It's because it helps you build authority in your community. It gives you great content to circulate about your specialty, the things you treat, things you do well, vestibular, musculoskeletal, balance, etc. It helps with your search rankings. If you have regular blog posts about particular conditions and you use the keywords with respect to where you're located, it'll help you rank for those types of things. For example, vestibular treatment in Los Angeles. And when it comes to people doing business, 94% of them are going online first before they do business with the local service in the community. So for all those reasons, you definitely should have a blog post. If you just consider the number of people in pain in your community, it's about 50%, and a lot of them need help. The problem is there's lots of competition for our physical therapy services. There's new practices coming in. There's the existing practices in your community. You have substitute services like chiropractic and occupational therapy and personal training and massage and medical doctors. So there's lots of competition in that respect. You have suppliers. So you have these POPs that used to supply you PT patients that are now bringing those in-house, as well as hospitals. And then you have more sophisticated buyers, and that's your patients that are looking for alternatives to opioids because they're hearing the same message you are, that opioids are addictive. So because of the competition, it's a great idea to help you break through the noise by having regular content in the form of blog posts. When you are writing your blog, you want to make sure you write for a specific audience. For example, patients in your community with sciatica. And then you can simply follow the who, what, when, where, how, why formula and use slide notes like I have here. This is all I'm doing. You can model this. Talk about who physical therapists are, the training that we have, the fact that we go to several years of graduate school. We're doctoral trained. Many of us are doctoral trained. And then we have fellowship training and internships and board certifications. And all we do is specialize in movement and the neuromusculoskeletal system. Talk about the particular condition that you treat, conditions that might mimic sciatica, for example. Talk about sciatica itself. If we're speaking about, sciatica with people with sciatica in the community. Talk about why you should see a physical therapist first, and there are a number of reasons why people should go to physical therapy first. There's little to no side effects. It's not addictive. It's affordable. You can get right in to a physical therapist, and a physical therapist takes the time to explain the problem in detail, which a lot of patients are not getting that type of care anymore in the healthcare system. Talk about where you can get physical therapy, and you can talk about hospitals and physician-owned clinics, but if you're a physical therapy private practice, give them some reasons as to why it's a good idea to go to PT private practice. Talk about when people should get physical therapy. John Childs and Julie Fritz have, among other authors, have written good research studies about why you should get physical therapy within the first couple weeks, for example, with back pain, and sciatica can be lumped into that as well. Talk about how people can get started with physical therapy. And then write an outline like I'm showing you here. I'm using Google Slides to do this, but you can just have an outline up there if you like. If you want to use a service like I have here and capture it on video, then do that as well and just have your outline up there for people to see. You can use something like Loom, which is at loom.com, or GoView by LogMeIn to record the video. And then after you get the video, post it on YouTube. So you'll have your blog post with your headline and your video, and then the transcription of your video right beneath it. And you can use a service like Temi or Rev to get it transcribed for $1 or a penny, $1 per minute on Rev and a penny per word on Temi. And then, like I say, put this transcription on your website under the video. And then when you're done with that, you can take that link to your blog post and you can post it out there on Twitter and Facebook. So by following a simple outline, speaking to a specific audience, and having an authoritative blog post that goes out 2 to 4 times a month and circulating on social media, you can quickly build authority. You can also use video so people can see you, and this helps build trust and familiarity and awareness of who you are. So that's why I like to use Loom or similar services as well. So hopefully these ideas help. If you have any questions about blogging, you can read some of our other blog posts here, or you can connect with us by phone or email, and we'd be happy to show you how we can help. Thanks for watching. Have a great day.